Having breast implants and really worried about pain and scars? You'll be pleasantly surprised to find out that we can now do this procedure with very little of either one. Hi, I'm Dr. Studin. I've been doing breast implants for decades, and I can remember the days where people would wake up after breast implants under the muscle, screaming in agony, begging for narcotics, take way too much medicine, get sick. It was a total nightmare. Thankfully, if your doctor is practicing modern, sensible medicine, those days are gone. Now, it can be done with almost no pain, and people feel great afterwards. To start with, let's listen to one of my patients that had it done the modern way.
I had my breast implant surgery yesterday afternoon, the 29th.
Okay. And how did you feel right after the surgery? Did you have any pain?
I had no pain. I felt great after the surgery.
Do you remember waking up and speaking to me in the operating room while you were still there?
Yeah, just after the operation, I woke up and I was talking to the nurses and to you.
And did you have any pain at that point?
I didn't have any pain at that point. I felt great.
How was the whole night for you last night?
Fine. I took my medication, but I barely had any pain. I was able to move up and down myself. I'm able to move my arms up over my head and down without any complications.
So you're able to get dressed, do your hair and all that stuff?
Yeah, all my own.
Okay, great. And you have no pain today?
No.
A little tightness or not, or what do you feel at all?
A little bit of tightness and basically just taking some Tylenol for pain.
Okay, turn to the side a little bit. You can see the implant slightly riding high, and these actually ride a little bit lower than they often ride right after the surgery with the pec muscle. Turn the other way. No, back around the other way. All behind you. There you keep going, keep going, keep going. Very good. Turn back to me. And you feel you were able to go back to your normal activity within a day or so, or how do you feel about that?
Probably. Today I was able to move around myself. So probably tomorrow I will be able to have much more energy. I just feel a little wiped out, but that's kind of normal. So tomorrow I'll definitely be...
Very good. And you happy with this so far?
Very happy. Thank you.
Okay. A little different than your friends have told you about having implant surgery under the muscle, right?
Absolutely. Very different. They were unable to move themselves and lift themselves off the bed, and I was.
Great. Thanks.
So how do I accomplish this miracle of modern medicine? Surgery without pain. The first thing to understand is that it takes 4 or 5 doses of an oral medication to build enough medicine in your blood to work. If you wait for pain and then take pills, you're going to absolutely hate me for 16 to 24 hours. That makes no sense. So the first thing I do in the surgery is I block the area that we're operating on with a long-acting local anesthetic. It lasts anywhere from 14 to 24 hours. That entire procedure takes me about a half an hour start to finish on both sides. And during that time, you needed very little anesthesia because I blocked you at the beginning of the case. So during the surgery, you had almost no pain at all. So you need less anesthesia to stay asleep. It's a win-win. Once you wake up and you're in the recovery room, you start your pain medicine then. You don't take it if you need it. You take it every 3 hours by the clock. Because if it's going to take 14, 16, 20 hours to build up enough of a blood level, and you're numb for that whole time, you can actually do your hair and move around. You're going to take your pain medicine in decreasing doses every 3 hours by the clock for 4 or 5 days. Now, people say to me, what about feeling badly? I'm going to feel knocked out and drunk. You get acclimated quickly. You don't feel as knocked out as you think. True, we don't want you driving cars and doing complex tasks and working. You're going to relax for 5 days or so, but you're going to feel much better than you think. So if you take a look at the patients that we've done recently, the vast majority say they had almost no pain at all. They had surgery Wednesday. They were back out and about to almost everything by Monday. I don't want you doing heavy lifting or going to the gym or twisting and turning for a couple of weeks, but by the 5th or 6th day, going back to an office job and generally socializing should be fine. So, in the end, it is possible to have this surgery now with very little pain and feeling much better than you thought.